Welcome to our Mental Health in a Digital Age series. I'm Titania Jorden, Chief Parenting Officer at Bark Technologies, and I'm here on location at Hillside with Gaan. So excited this has finally come to fruition.
Thank you so much for being here.
Yeah. So Gaan, first tell us, what do you do here at Hillside?
So I am the Director of Clinical Education and Outreach. A lot of what I do is educating parents, the community, clinicians on mental health, on levels of care, on treatment, especially for children and adolescents who need higher levels of care.
This is going to be so impactful. I am so honored to talk to you today, not only in this professional realm, but also as a parent of a high schooler now. I'm in this space and I didn't know about the levels of care, right? So if I don't know about the levels of care, how many more parents out there don't understand what comes next? So if we could start with just education on the levels of behavioral health. You know, obviously if your child has a fever for a long time or breaks a bone, you go to the pediatrician, you go to the ER. But when your child is struggling with their mental health, with their emotions, what are the levels of behavioral health care that exist?
Yeah, and I think it's one of those things that you don't think about until you're in it, right? And then when you're in it, you're in crisis, and it's really hard to figure out what levels of cares are in mental health. Most people think of regular outpatient, you know, most people are familiar with that, going to see a psychiatrist or going to see a therapist on just a regular once a week or once every few weeks. And then a lot of times when things are a little bit more serious, people just think, just like a physical health thing, well, we go to the hospital, right? Like we go into the ER, or we go into a psychiatric hospital. And in reality, there are levels of care that are in between that. We don't need to always default to going into a hospital because sometimes that is just kind of overkill. That's more than what we need. There are intensive outpatient programs. There are things that are like a hospital called partial hospitalization program, where your child still stays at home with you, but they are in treatment Monday through Friday or throughout the week as a full day instead of school for a period of time in order to really stabilize the crisis, address some of the symptoms, and really learn skills in order to get back to, you know, their life. And so I would start with maybe the lowest level of care first, right? We always want to default to the least restrictive, lowest level of care. So you have regular outpatient therapy. So this would be, you know, talk therapy once a week, maybe with a therapist. You then, if talk therapy is not working and, you know, a client could really benefit from some medication, then that's where a psychiatrist could come in, right? And so it might be a combination of talk therapy and some medication. Then we might need to look at a program that is more intense than just once a week. Sometimes you have programs that are intensive outpatient, or IOP is the acronym. You'll see a lot of acronyms in mental health. IOPs ranges from, you know, a few times a week to maybe 5 days a week at, you know, 2 hours a day. Most IOPs kind of range from anywhere around 9 hours to maybe 18 hours a week. And so it just depends on the program. It depends on the need, on how the treatment is planned. IOP is really helpful for, you know, teens and clients who are starting to have symptoms disrupt their day-to-day functioning. You know, they are really kind of, you're noticing the difference. They're having a hard time making it through the regular day, following their routine. A higher level of care than IOP would be a PHP, or a partial hospitalization program. Some people call it a day program, where you just go to treatment for the day, right? They still stay at home. They still function as part of the family. However, you know, during the day, they would go, they would be in therapy groups, they would do individual therapy, they would see psychiatrists about medication. They would get a lot of support And so partial hospitalization program, or PHP, it's also different, in different settings. Some people meet Monday through Friday. Some programs will meet 7 days a week based on the clinical need. Most PHP or day programs will be time limited, same with IOPs. You're not going to go to these programs forever. You go for an amount of time that will help stabilize the high acuity symptoms, and then you might step down to a lower level of care or back to outpatient. And it's just one of the ways in which we can help, really come alongside your kiddo, help come alongside the family, give a lot more support in order to get back to their day-to-day functioning.
So if I'm going to recap the levels of care, it's, I'd say maybe school counselor, pediatrician for that initial assessment if you're worried, then perhaps a therapist, a licensed professional counselor, then perhaps psychiatrist if there's medication that might need to be prescribed. And then you don't need to jump right to full hospitalization. What we're talking about now is those levels of care in between that a lot of people might not realize exist. And so that's IOP,
intensive outpatient,
and then PHP
is partial hospitalization.
Okay. And then is there anything between PHP and full hospitalization?
So in terms of the next step, usually, hospitalization is the inpatient short-term acute hospitalization would be used when a person is at imminent threat, right? Like they have a suicide ideation and a plan and means in order to carry out ways of harming themselves or harming someone else, or they're having some active psychosis, symptoms of having delusions or hallucinations and things like that. That's when, really hospitalization is needed.
Right.
Because they do need around-the-clock care, right? It is surprising, I think, a lot of times for parents to know that just having suicidal ideation doesn't mean that your kid has to be in a hospital.
Yeah.
Having suicidal ideation without a plan or without intent, or what we would call passive suicidal ideation, can be treated at an outpatient level and treated effectively as well. One of the things that happen when, kids go into the hospital, it could be really traumatizing.
Yeah.
Right? Because they're away from their family. It is a very intense level of care where people are checking on you every 15 minutes to make sure that you're okay.
Yeah.
And when you really think about it, some kids need that, if they're at the place where they're at imminent risk. And a lot of kids don't need that, and we can really address a lot of the safety, and step up maybe a little bit of safety in the home and work with a clinician who is skilled at working with kids who are having suicidal ideation or self-harming behaviors in order to stabilize these symptoms effectively while they're still living at home with you.
A lot of times people think, yeah, therapy's nice if you can afford it. But thankfully, Hillside actually works with certain insurance providers, right?
You're correct. And as one of the oldest nonprofits in Atlanta, we've been working with children and families for a really long time. It is part of our mission to really provide quality care that is accessible to most people. And so what we really try to do is then work with all insurance. So we have people from all backgrounds, economically, that accesses treatment. They can use their health insurance anywhere from private commercial insurance, where some people have insurance through their work, or TRICARE, if your parent is in the military or veterans, or families that might access health care for their children through Medicaid. We're able to help support a lot of families just kind of from all walks of life. So Hillside's really proud that we were able to do that.
You should be. That's critical that this level of quality health care is available to all who need it and not just those who can afford it.
And it is hard, to navigate healthcare, even with access, in terms of funding. There's still other barriers, for different families. When we talk about IOPs and PHP, you're also looking at, does this family have the ability to transport their children to treatment? Right. So for some families, barrier to treatment is not just, can I afford the treatment, but it's the, can I afford to take off time from work, or can I afford the gas to get there every day? And so these are issues that we as a society really have to think about and give where we can. There's definitely things that we can do in order to advocate for more access. That's not just funding treatment, but really coming around people and helping them access treatment.
Yeah, problem solving, and sometimes creatively.
Yes.
Hillside also offers in-home care too. Can we talk about that?
Yes.
Okay.
So I didn't talk about it at first because it's kind of a unique program.
Yeah.
Not a lot of people offer in-home care. Hillside has a intensive in-home therapy program that is in network with a few insurance. And part of the issue that is not in network with all insurance is that a lot of insurance don't recognize in-home care as a benefit for mental health. But with Hillside's intensive in-home therapy, it is typically about 4 hours a week in the home or in the community. So even though we say it's in home, it's not always just in the home. We come alongside the therapist or the psychiatrist that the family is already seeing to help give additional touch points through the week, to be accessible for the family 24/7, whatever they need. Oftentimes what we see is that even in treatment, especially with kiddos, you can go into a therapy room and then you talk about the things or you learn about a skill, but they're having a really hard time translating that into real life. Same for parents. Sometimes we talk about behavior management plans and, you spend a lot of time and effort coming up with something that would be really effective. And then when it comes down to the time to implement and you're just like, I'm not sure how to do this, right? And so our intensive in-home team is that team of clinicians who will come to you, who will help with implementation in the home or in the community. For example, we've seen a good bit of kids in the past few years because of COVID who really struggle with returning back to school due to anxiety, due to just a lot of mental health symptoms. And so one of the things that, the kiddo might be working in their typical therapy is talking about their anxiety and some skills that they can use in order to manage that anxiety. But the intensive in-home therapist would say, you know what, before school starts, let's go up to the school. Let's get your schedule. Let's walk through the school building and find your locker and find all your classrooms, and let's breathe through this, right? Let's make an appointment with your school counselor before the semester starts and talk about our cope ahead plan for when things are starting to get a little bit hairy, that you can go to your counselor and they know what the plan is, so that you have something already in place in order to be successful. If the treatment goal is to be able to make it through the school day successfully. And so it's coming alongside the kids, coming alongside the families in just whatever capacity that they need.
That's awesome. Gaan, there are times when, as a parent, you feel like you don't know what to do. You're not quite sure about the next step. Can you talk to us about the warning signs that you do need to seek out a higher level of care?
Yeah, so one of the things that, if you're already in regular outpatient services, right, and it just doesn't seem to work, if symptoms are not getting better, if symptoms are starting to get worse, that's number one sign, right, of, okay, maybe we need to do a little bit more. And sometimes, we think our kiddos are fine, and then all of a sudden we find out about something like, self-harming behavior, or we find out about suicidal ideation. anytime self-harm and suicidal ideation comes into play, those are the things that I generally would say, let's get an assessment to see if we need a higher level of care, because those are the things that you just don't want to take any chances. Even though self-harming behavior does not always mean that a client, a child is suicidal. However, self-harming behavior is still the number one predictor of a completed suicide. Wow. So we take that very seriously in order to make sure, right, that they are gonna get the treatment that they need. So anytime, self-harming behaviors, suicidal ideation is mentioned, higher levels of care is something we want to look at in order to stabilize those high-risk behaviors. Other things that we can look at, would be maybe substance use. Mm-hmm. And it's so hard because teenagers, right, part of their developmental kind of life stage is kind of exploring a little bit, and maybe there's some dabbling and there's some of that experimentation. Mm-hmm. And not all of that means that they immediately need to go to rehab. Right. However, if we're looking and seeing, there's actually a habit, they're using all the time. They are hanging out with friends and peer groups who are heavy users. That's really a big red flag that we really need to seek support. Same thing with disordered eating, right? There are all these kind of presentations where, are they losing weight? Are they engaging in behaviors like purging that we need to be concerned about? To be safe, at worst, you go to get an assessment and they say, you don't need a high level of care, you just need to see an outpatient therapist. Yeah. And that's great. But we don't want to take any chances when there's any kind of more severe psychiatric symptoms. One of the other things that a lot of times people don't think about as a severe psychiatric symptom is that if there's drastic changes in sleep patterns, if there's drastic changes in their eating behavior, and not just like with eating disorders, but even with depression and anxiety, sometimes we'll see a big change. And then big changes in their social engagement, if they're all of a sudden isolating a lot, and if they just stop doing the things that they used to care about, those are really big red flags where we want to just say, let's get this checked out. But any time that, as parents, we kind of have that little spidey sense. Yes. And something in our gut is saying, something's not right here. Trust that. Yes. Go and get an assessment. It does not mean that they need a higher level of care. It just means that we are not going to ignore symptoms. Just in the same way with our physical health, right? If our kids are just having a little bit of like a stomach ache, but it's persistent, right? That's when we're like, oh, maybe we should call the doctor. So that kind of persistence, the intensity and the frequency is what we want to look at. And that's going to be the key determination in terms of symptoms of what level of care is going to be needed.
Awesome. Gaan, what should parents ask when they're looking for the right program for their child?
Yeah, because there's so many programs, right? Not only were we navigating levels of care, and now let's say, okay, we're looking at intensive outpatient. Well, there's 8 different intensive outpatients in Metro Atlanta. Which one should I choose? Right. So first thing, when we talk about any program, intensive outpatient, partial hospitalization, most of the time, the first factors you talk about is kind of, what time do they need to be there? What time do they need to get picked up? How much is this going to cost? Those are kind of, your standard given. But what you want to do is dig a little bit deeper, because if you're going to spend, you're going to invest this time and the financial resources to get treatment, you want to make sure it's the right treatment for your family. So when you ask about their schedule, right? What is the time commitment? Some programs say, oh, we only meet for 2 weeks. Some program says, no, we need you to commit to 6 weeks. Some program says, no, we need you to commit to 12 weeks. Well, why is that? Tell me more. Because different presentations might require different things, right? So not only do you want to know what the time commitment is, but why is that the reason? What does the schedule look like? What will my kid be doing? Because what you don't want, right, is your kids there, you think in treatment, and they're just kind of sitting around watching videos.
They can do that at home.
Right, exactly. And so you want to see what will my kid be doing in this treatment program? And then other than, what's part of their schedule, who will be seeing them, right? Some programs, it's only group therapy. Who's leading these groups? Are they therapists? Are they paraprofessionals? Are they led by nurses or, psychologists? Or what does that look like? What is the purpose of these groups? Will it include individual therapy? Would it include family therapy? And then, would it include psychiatric medication management?
Right.
So if they say, oh yeah, they'll, work with a licensed therapist, but they won't see a psychiatrist or a nurse practitioner, then they're probably not going to address it from the medication standpoint, right? And so you want to see who will be treating my kids, right? The other question that we want to consider is then, so who are these other kids in their group milieu?
Yeah.
Because, some programs have a wide range of ages. Some are single gender. Some are co-ed. Some have really specific treatment goals. So if you have a kid who is using substance, are they going to be in a group with other kids who are struggling with substance use? Or are they going to be in a group with a bunch of kids who are struggling with suicidal ideation? What does that look like? Right. You don't have to know the super specific part, but you want to kind of know the broad brushstrokes. Group work can be so powerful for teenagers. That's part of their life stage, that whole peer thing.
Yes.
And it could kind of be detrimental too if it's not the right clinical fit. And so you want to know, okay, so who would my kid's peer group look like in this treatment program? And not only what the peer group looks like, how does staff handle, that kind of peer-to-peer relationship? Are the kids allowed to talk to each other outside of treatment? Are the kids encouraged to make friends with each other? Because different treatment they're gonna have different goals. If you have a group of kids who are learning social skills, yes, they're gonna encourage friendship. If you have a bunch of kids who are struggling with substance, we're not gonna want to encourage those friendships, right? And so those are the kind of things that you also wanna ask in terms of who's treating my kids, who will my kids be around? One of the things that I think personally is really important when you're looking for programs for children and adolescents is what would my involvement be as a parent or as caregivers? Because even though our child seems, they're the ones struggling with the mental health or the behavioral health issues, children don't exist in a vacuum.
Right.
They exist in a family system. And so how can I be part of, coming up with treatment planning? Because even though the professionals are the experts at maybe the treatment modality, you as a parent, you're the expert on your child.
Yes.
You know their routine, you know their temperament, you know their ins and outs and how things have changed. And so a program that is going to involve you and use your expertise on your child and really incorporate goals that are going to be appropriate treatment goals for your whole family is going to be really important. You want to also choose a program that you're going to feel comfortable, right?
Yes.
That you're not going to feel judged. You're not going to feel, that
you're left in the dark.
You're left in the dark, that they're going to have good communication. And personally, I feel like family therapy is always a big, big thing anytime you look for treatment for children and adolescents. And it does not necessarily mean that something's awry, in the family system in the sense that, it's so dysfunctional. It just means that we need a little bit of support to empower, because most of the time is that as parents, we are doing the best that we can. We are doing the best that we can to help our kids, and it's not enough. right? And so this is the part where the professionals can come and empower you and give you some extra tools in your toolkit in order to help manage some of the symptoms and alleviate some of the symptoms for your kiddos. And so, the family involvement and engagement is another big piece of it that we want to look at.
Wow, you have given us so much more to consider when you are looking for the appropriate level of care for your child. This is so helpful. Thank you so much. I'd love to talk now about how the integration of telehealth and virtual therapy changed the landscape of behavioral health care for children, and what benefits and or challenges does this prevent for parents?
Yeah, so, one of the few good things during the pandemic years is that, people got really comfortable with kind of virtual meetings and appointments. And especially in Atlanta where the traffic is just a beast,
oh my gosh.
To not have to get in the car or not to have to commute is a huge bonus, right? What we know from studies is that for people who are appropriate for telehealth, treatment outcomes generally are about the same from virtual treatment and in-person treatment.
Wow.
However, my qualifier is that people who are appropriate for this type of treatment, right? So Hillside has a virtual IOP program that serves, of course, children and adolescents ages like 12 to 17. Now, one of the things that we want to see is this kid going to thrive and be able to stay engaged in this virtual programming? Sometimes parents off the bat just say, oh, no, we just can't do virtual, because we kind of all have a little bit of bad taste from when the pandemic started and everybody's trying to homeschool that first 2 weeks, and they're just like, this is such a nightmare, right? However, what we want to look at is that, some programs do a really good job. Like, I feel like Hillside's therapists do a really good job keeping the kids engaged in the virtual programming. And so one of the things that they generally look at then is what kind of kid would not be appropriate for virtual. So first things first is kids who may struggle with psychosis or psychotic symptoms, right? If they're having active hallucinations or delusions, that's really difficult to assess when you're not face-to-face and in person. And so those kiddos are not generally a good fit for virtual treatment, or really anyone with those type of symptoms, because the clinician can't really get a full picture of what's going on. The other thing would be people who are really struggling with substance use, especially if there's no way to keep accountable.
Right.
It's really hard to say if a person is high or drunk, on a screen. And that's definitely going to be unhelpful,
right?
If they're going to treatment without really showing up in all those ways. A lot of those things like substance use, active substance use, active psychosis, those are the things that you can't miss when they show up in person, right? Like their body language, the way that they walk, the way that they move, even the way that they smell, right, is a big clinical clue for their eyes. Or their eyes, yeah. And you don't miss that in person. You miss that on a screen.
Yeah.
The other thing, with teenagers especially, is that if they have a history of problematic internet use, treatment online might not be the best thing, right? Because we really can't guarantee, that they are going to stay engaged online. They might have the screen open, but they could have another window open doing things that they're not supposed to.
Right.
And so there's a little bit of that assessment that needs to happen. However, on the plus side of it, if the kid could be a good fit for virtual programming, or anyone for that matter, the plus side of it is that it becomes so much more accessible.
Right.
A lot of specialized treatment is not offered in areas that are not just big cities, right?
Right.
Specialized treatment protocols and things like that are generally not offered in smaller towns or rural areas. All of a sudden, the use of virtual programming opens this whole possibility up for access for folks in order to be able to really access specialized life-saving protocols. And so there's definitely a benefit there. Of course, there's the practical benefit of not having to commute,
Right.
And just making it easier for treatment to happen and just taking away a few more obstacles for consumers in general.
Yeah. So Gaan, we would love to hear some success stories or just positive outcomes for children who have received care at all the different levels of the behavioral health continuum, because as you mentioned, when you're in that mode, deciding what kind of care you need, you're in crisis mode. So hopefully you can share some stories that, of parents and kids who have come on the other side of it and have been helped and are now in a better place.
Yeah, and several stories come to mind. Most of my career, I have worked with kids who are in high levels of care with high acuity. And, in the family session, I see it in all parents, right? That worry that, oh no, like this is gonna ruin their lives, right? Like we think in that moment that something so big is gonna make an impact for the rest of their lives. And in a sense, it does make an impact for the rest of their lives. And treatment can be really helpful. And part of that lesson that might learn is how resilient they are, right? That they can go through something so hard and come out on the other end stronger as a person and as a family. So we have had kids in our residential program who have multiple suicide attempts. And really by sheer luck that this kid did not die by suicide, and the attempt was interrupted is what happened. We've had kids who, when they came to us, they look like a butcher's block because they have self-harm so badly. And you look at these kids, and as parents, when you're in that moment, it is hard to imagine how things could be better. And I'm so happy to say that these are the kids that we've seen in our residential program that actually went through the treatment and came out on the other side. They are the families that email us 2 years after they left our program and say, hey, kiddo's doing so well. They just got accepted to school. They're gonna actually go out of state to college, and this is what they're gonna do. And it is actually one of the reasons I keep doing what I do, right? Because it makes such an impact. We are literally saving lives, and we're changing the course of their life. At the end of the day, treatment can really help a kid figure out and build the kind of life that's worth living. When things are really dark, when they just don't feel like life is worth living anymore, that's where treatment comes in. A lot of it, is not gonna be linear. It is not gonna be, we come and we do this one thing and then everything is magically better. Realistically, I do want parents and families to know that, sometimes it took years in order to get to this really dark space, and it might take years in order to get out of it. And when I talk about years, it's not that it has to be a really high level of care always. It might be a combination thereof. And treatment, even though there are different levels of intensity, is also not linear, right? We might have a kid who does regular outpatient, and then, their symptoms have exacerbated, and then they go into a PHP or a day program, and then they do better, and they come back out to regular outpatient for a while. You might have a kid who does the whole continuum of, man, they have had some really, really scary close calls and they've been hospitalized, and they need residential treatment program where it's a little bit more long-term and really help build some skills in a really safe environment. And then stepping them down into an outpatient program and then go into regular, once a week therapy. So the treatment process could be kind of anywhere in between and whatever is needed. It doesn't mean that they're always going to be at super high levels of care.
Yeah.
And it doesn't mean that things are always going to be smooth sailing, right? Sometimes we do hear, from a client and family that, did wonderfully at high levels of care, and they are, so, positive and everything is going really well. And then something happened outside of their control with their family. Something tragic happens. And then all of a sudden it's like, oh, we might need a little bit of extra support right now. And so they might come back into an intensive outpatient program in order to just get, maybe a little bit of a tune-up, or just a little bit more support in that moment. And so those are the things that we think about when we're talking about treatment, the course of treatment in general. And when we fully engage in treatment and we actually put forth the effort to do it, and follow through with the recommendations, we see positive outcomes. Like families continue to thrive, and they come out so much stronger on the other side, because not only did they overcome such a big obstacle together, they also come out with the tools and the ability to communicate and talk about hard things, right? And these are the things that carry on into adulthood for these kids.
And they pass down to future generations.
Exactly.
Can you speak to, and no pressure if you can't, but the nuance of parents feeling like a failure, like if their child does end up needing this level of care? I feel like there are parents who are like, what did I do wrong? How come I wasn't able to help my kid fully? How come I'm not able to help my kid be okay? Can you speak to that at all? Of like,
definitely, yeah. I think there is so much there's the stigma, as one thing, but there's also a lot of shame and blame, and I said it already, I'm going to say it again, that most parents we know who are, have kids in our higher levels of care really are doing the best that they can. And I say that wholeheartedly because I know that it is really hard to be a parent, and being a parent in this day and age where we're navigating so many other things that we didn't have to deal with, when we were children. And there's things about mental health that is way outside of our control. There is definitely kind of the genetic factor, that we just don't have any influence over, right? Like they unfortunately sometimes draw the short stick, and depression or anxiety runs in the family, right? There's also just a lot of kind of, I think, isolation that happens with parents when you're parenting a child who is struggling with mental health issues, because you get people who are well-meaning but really don't understand, that are just giving suggestions or having critiques that you're just thinking, well, if it was that easy, don't you think I would have done it already, right? And so first off, I want parents to kind of stop for a second and validate themselves, to say, hey, like I've done the best that they can in order to keep my kids alive so far and still keep the family functioning, because you still got to pay bills. You still have to take the other kids to school. Like life doesn't just stop when one of your kids have mental health issues. So first off, I want parents to stop and just say, hey, I need to just kind of say, I've done the best that I can. And there's absolutely no shame in asking for help. And I think part of it is thinking in the same way that our mental health and our physical health are just really not that different, right? Like if your kids are having some physical issues and you're not a doctor, and even when you're a doctor and it's like a specialized issue, you would want to take them to someone who is trained to really work with that particular issue. And so with mental health, it's the same thing. It is what their brains are doing. There's so many different components that's involved, that really you want to be able to engage with the professionals who are trained to work with this really specialized need. And there's, I think, our own moral judgment, and I think that's just part of the stigma that we just need to be aware and mindful of, that, okay, maybe that's my own kind of hang up on something is wrong with mental health, therefore it means that something, that morally is wrong. And that's not really the case. Is that let's look at this on that perspective of that their brains are just not doing what it's supposed to, right? And we need to figure out a way to do this differently. And, people talk about their brains and they're like, well, what does talk therapy do? And even talk therapy rewires the way in which the brain functions, and so one of the beauty, I would say, is that children and adolescents, their brains are still developing.
Yes, they have that neuroplasticity.
Yes, more so than adults. And it is the best time. It really is the best time to get treatment, because if we can learn the skills and the tools now when they're young, we're just really minimizing a lot of suffering that could happen in the future.
That's a great lead-in to talking about early intervention. So before I go into that, I just want to, thank you, Gaan, for helping to reduce some of that stigma and shame and just despair that parents feel when, as a parent, it's your job to keep your kid safe and healthy, both in real life and online. And when you are at that point of feeling like you can't do that, not because you haven't tried and not because you don't love your child, but you are not equipped to be able to handle a certain level of care that's needed. And it's okay to call the professionals. Just like you say, it's okay to not be okay if you're struggling. It's also okay to not have all the answers. So just want to give parents watching and listening some grace that it doesn't mean you're a bad parent, just means you need some help, and that's okay.
And it means that you're a good parent, that you recognize your own limitation.
Yes.
And you say, hey, my kid needs help, so I'm going to do it. I'm going to do whatever it takes in order to help my kid feel better and do better and all of those things.
Absolutely. I'm not going to try to stitch my kid up,
Exactly.
when he needs to go to the ER and get stitches from a professional. That's what we're talking about here. But let's talk now about early interventions, and what role does early intervention play in preventing the escalation of mental health issues to a point where higher level of care might be necessary?
Yeah, and one of the things that I will always advocate for is early interventions. And I know we've talked about red flags. I know that we've talked about warning signs to look at of what are the things that, we want to look at, seeking out a professional. Yeah. One of the things that a lot of times I tell people is that things don't have to be wrong for you to go to therapy. Right?
What a revelation.
And I know actually, a lot of folks who go to therapy or seek out, mental health professionals, not because something's really wrong, but because they want to do better.
Prevention.
Right?
It's let's exercise to keep our body strong, not because it's way past the point of
exactly
body care.
Right. And so instead of thinking about, mental health symptoms and mental illness, I want us as a society, and as parents to really keep in mind mental wellness instead of mental illness, right? What are we doing in order to bolster mental wellness in our family? And that could be that we have dedicated family time and we, exercise and we eat a healthy, balanced diet, and we're keeping a really close eye on sleep, right? And those are the things that are helpful in general for mental health. And it might be that, we've been fighting a little bit more than normal, maybe we do engage someone so that we can have a more effective way of communicating, so that it never gets to the point where your kids feel like they can't talk to you and then they're hiding things from you, right? It's that nothing's really wrong, except we could do a better job communicating, and let's kind of learn skills to do that. And so in terms of early intervention, don't think of it that we need to intervene when things go wrong. Think of it as, what can I put in place in order to really bolster wellness?
Yeah. Wow.
I think at the end of the day, I want parents to know that there is help, right? That there's hope if their kiddos are in this space right now where things just feels really, really dark. That treatment is effective. They don't need to continue to suffer. I want parents to know that what they do matters more than what they say, always. If we model the behavior we want to see, we're going to be so much more effective, whether it's tech use, whether it's communication, whether it's how we regulate our own emotions. I think that's one of the most impactful thing that we can do in order to help our kids, is really modeling what we want them to do.
Amazing. Amazing. Gaan, thank you so much for being here, for your insights, for your calming presence, for your wise words, and for all that you and Hillside do for the community.
Thank you so much for this opportunity.